Sir, I need you to stand up, now. What are you doing here?
When will my service give me the right to be heard, not just seen kneeling?
Veteran begged for help. Then a Black Hawk landed in the hospital parking lot. They said Colonel David Miller would die waiting for care at Westview Medical Center. But then, against all odds, a Black Hawk helicopter landed in the hospital parking lot, launching a daring rescue that exposed deep-rooted discrimination and sparked a nationwide fight for veterans' rights. The dawn was thick with fog as Westview Medical Center loomed over the quiet city streets. Its glass walls reflected the pale light, sterile and unyielding. Inside, the antiseptic scent mingled with the low hum of fluorescent lights and the soft shuffle of anxious feet. The waiting room was a mosaic of faces, some hopeful, others resigned. The atmosphere was heavy, charged with silent tension. Colonel David Miller, 67, entered slowly, each step weighted by pain. His once proud posture was now bent slightly forward, his hand pressed firmly against his chest. The years of military service had left invisible scars, but today it was his heart that betrayed him. His dark eyes, sharp and commanding in uniform, now flickered with uncertainty and fear. He had survived battles overseas, but this was a battle for his life in a place meant to heal. David's life had been defined by discipline and courage. Decorated for bravery in combat, he had endured hardships that tested the limits of human endurance. Yet here, in this hospital, he faced a new kind of fight, one against a system that seemed indifferent, even hostile. His daughter Sarah, a successful attorney, had urged him to seek help immediately. But the cold reception he received was a harsh reminder of the barriers still standing. At the front desk, Susan Clark, the receptionist, with unnaturally bright blonde hair and a practiced smile, barely acknowledged him. Nearby, Mark Thompson, the security guard, watched with narrowed eyes, suspicion etched into his features. Despite David's clear distress, sweat beading his forehead, labored breathing, he was left waiting as others were seen first. The sterile walls seemed to close in the air, thick with unspoken judgment. The challenge was not just the pain in his chest, but the invisible barrier of prejudice. His strength was fading, but his resolve remained unbroken. This was not just a fight for his life, it was a fight against a system determined to let him fall. Colonel David Miller's decision to come to Westview Medical Center was born from desperation and urgency. The stabbing pain in his chest had worsened through the night, each breath growing more shallow and labored. Memories of past battles flashed through his mind, but this was a fight unlike any other one for his very life. His daughter Sarah's voice echoed in his thoughts, firm and insistent, "Dad, don't wait. Get help now." Despite his pride and stubbornness, he knew she was right. As he approached the reception desk, hope flickered faintly within him. But the sterile hospital environment, with its cold fluorescent lights and antiseptic smell, felt unwelcoming. Susan Clark, the receptionist, with unnaturally bright blonde hair and a practiced smile, barely looked up from her computer screen. "Name?" she asked, her tone clipped and detached. "David Miller." "Chest pains?" he replied, voice strained but steady, trying to mask the growing fear. Susan's fingers hovered over the keyboard. Then she said flatly, "Wait your turn." Nearby, Mark Thompson, the security guard, watched David with narrowed eyes, suspicion etched deep in his face. When David shifted uncomfortably, Mark's voice cut through the quiet waiting room. "Sir, are you intoxicated?" David's jaw clenched tightly, a flicker of hurt and disbelief crossing his face. "No," he said quietly, but the accusation hung in the air unchallenged. Minutes stretched into what felt like hours. White patients who arrived after David were called in first, their names echoing through the sterile halls. David's breaths grew shorter, sweat beaded on his forehead, and his hand pressed harder against his chest, but no one came to help. Sarah arrived, her eyes sharp and filled with determination. She scanned the room quickly and immediately confronted Sharon Green, the supervising nurse, tall, thin, with prematurely gray hair that framed a face hardened by years of bureaucracy. "My father is having a heart attack," Sarah said, voice firm and unwavering. "He needs immediate care." Sharon's eyes flickered with annoyance, but she maintained a professional mask. "We follow protocol," she replied, her tone cool and dismissive. Maria Sanchez, a young black nurse's aide on probation, stood nearby. She noticed David's worsening condition, the pallor of his skin, the labored breathing, the beads of sweat on his brow. Her heart pounded as she risked her job to perform a quick assessment. The results were undeniable. David was experiencing a cardiac event. Sarah's voice grew sharper as she threatened legal action, forcing Dr. Stephen Parker, a reluctant and defensive physician, to order urgent tests. The results confirmed the truth: David was dying. In a quiet, tense moment away from prying eyes, Maria slipped Sarah a USB drive containing damning evidence, a pattern of delayed treatment, and 3 minority patient deaths at Westview Medical Center. General William Hayes, David's longtime friend and a high-ranking military officer, was contacted immediately. The stakes had risen beyond a single patient. This was a fight for justice. This moment marked the beginning of a battle not only for David's life, but against a system steeped in prejudice, neglect, and institutional failure. Sarah's resolve hardened, Maria's courage blossomed, and David's fate hung precariously in the balance. Despite the clear and urgent diagnosis of a heart attack, Colonel David Miller was moved to a low-priority ward, a dimly lit room at the far end of Westview Medical Center. The walls, once white, now appeared dingy and cold, reflecting the hospital's indifference. Sarah refused to leave her father's side, her eyes scanning every movement of the staff, her hands tightly clutching his frail ones. She meticulously documented every delay, every dismissive glance, every whispered excuse. Dr. Michael Chen, a meticulous and principled physician new to Westview, had been reviewing David's chart when he noticed glaring discrepancies. The notes were inconsistent, vital signs underreported, and the urgency of David's condition downplayed. Confronting Dr. Stephen Parker, the attending physician, Chen's voice was steady but firm. "Why is the patient's condition being minimized? This is a clear cardiac emergency." Parker's response was cold and evasive. "We have considerations, protocols. Sometimes we have to make judgment calls." Chen's eyes narrowed. "Are you suggesting bias?" Parker's silence spoke volumes. Meanwhile, Maria Sanchez faced mounting pressure. Her advocacy for David had not gone unnoticed by hospital administration. Rumors circulated that her probationary status was in jeopardy. Yet Maria's resolve only strengthened. She quietly rallied other staff members who had witnessed similar neglect, sharing stories of patients whose conditions were overlooked, especially those from minority backgrounds. Hospital CEO John Adams, an impeccably dressed man with a calm demeanor, was caught in the eye of a brewing storm. As news crews arrived, cameras flashing and microphones thrust forward, Adams struggled to maintain control. His carefully crafted public statements about commitment to patient care rang hollow in the face of mounting evidence. Colonel Thomas Wilson, a Black board member of Westview and a veteran himself, was not content to watch silently. He demanded a meeting with Adams, his voice low but resolute. "This is not just about one patient," Wilson said. "It's about systemic failure. We must act now." Sarah uncovered a shocking truth. Ambulances were parked idly on hospital grounds, yet David's transfer was inexplicably delayed. She confronted hospital staff, her legal background sharpening her questions. Why are these ambulances not being used? Is this deliberate? Social media exploded as veterans groups and activists rallied around David's story. Hashtags calling for justice trended nationwide. The public outcry grew louder with each passing hour. In a desperate attempt to cover up, Dr. Parker tried to alter David's medical records. Maria, ever vigilant, captured the act on her phone, adding fuel to the fire. Dr. Chen was suspended for refusing to sign a non-disclosure agreement that would silence him. His principled stand only drew more attention to the hospital's failings. Senator Robert Davis, a silver-haired political heavyweight with deep ties to private prison corporations known for mistreating Black veterans, intervened. He pressured hospital leadership to suppress the scandal, threatening funding cuts and political fallout. General William Hayes, David's longtime friend and a respected military figure, was contacted. Recognizing the gravity of the situation, he reached out to Brigadier General Laura King, commander of a nearby military medical facility, requesting urgent intervention. The battle lines were drawn. David's fight for survival had become a fight for justice, exposing the rot at the heart of a system that had failed its most vulnerable. The atmosphere inside Westview Medical Center had shifted from tense to volatile. Senator Robert Davis, a man whose silver hair and polished demeanor belied the ruthless political operator beneath, was determined to suppress any scandal that threatened his vast interests. His connections to private prison corporations, infamous for mistreating Black veterans, gave him a personal stake in silencing Colonel David Miller's story. As news of Miller's plight spread beyond the hospital walls, Davis mobilized Precision Security Consultants, a shadowy firm specializing in handling sensitive matters discreetly. Their operatives arrived at Westview with quiet menace, their presence a chilling reminder to staff that speaking out would come at a price. Whispers of intimidation and veiled threats rippled through the corridors. Inside the hospital, Susan Clark, the receptionist who had once dismissed David's pleas, found herself racked with guilt. The weight of conscience pressed heavily on her. One late evening after her shift, she secretly recorded a conversation with a supervisor revealing the hospital's unwritten policy, delaying or denying care to minority patients to manage costs and avoid scrutiny. With trembling hands, she passed this crucial evidence to Maria Sanchez. Maria, despite the risk of immediate termination, used the distraction Susan created to help move David to the hospital's rooftop helipad. The air was thick with urgency and fear. Dr. Michael Chen, Maria, and a small group of sympathetic staff formed a protective circle around David, shielding him from hospital security, determined to prevent the transfer. Colonel Thomas Wilson, a Black board member of Westview and a veteran himself, invoked military emergency protocols, asserting that David, as a decorated veteran, was under military medical jurisdiction. His voice was steady, commanding respect. "This man's life is not yours to gamble with." Sarah Miller, faced relentless pressure. Political operatives aligned with Davis threatened her legal career, attempting to intimidate her into silence. Attempts were made to erase David's military records, undermining his identity and claim to care. But Sarah's resolve only hardened. Fueled by love and justice, the story exploded into the national spotlight. Social media campaigns, veteran organizations, and civil rights groups amplified the outrage. Hashtags demanding justice trended nationwide, and public protests erupted outside the hospital. Hospital CEO John Adams found himself cornered, forced to convene emergency board meetings. His carefully maintained facade of control cracked under the weight of mounting evidence and public fury. David's condition worsened with every passing minute. The rooftop helipad became the stage for a desperate final act. Hospital security attempted to forcibly remove David, but Dr. Chen and Maria stood their ground, their determination unwavering. The tension was palpable, a battle between compassion and cold bureaucracy. Outside, storm clouds gathered, mirroring the turmoil within. Captain Jessica Rodriguez, a skilled Black Hawk pilot, prepared for a daring rescue mission. Her aircraft was fueled and ready, but the weather threatened to delay what could be David's last chance. Inside the hospital, heated debates raged. Senator Davis tried to control the narrative, deploying media allies to spin the story, but the truth was too powerful, and the tide of public opinion was turning against him. The moment of reckoning was near. Lives, reputations, and the very soul of the institution hung in the balance. This crisis was not just about one man's survival, it was a battle for dignity, equality, and the right to be seen and cared for without prejudice. The storm outside Westview Medical Center was relentless. It was not merely weather, it was a siege. Rain hammered the rooftop helipad where Colonel David Miller lay pale and fragile, a soldier being defeated not by an enemy on the battlefield, but by a decay from within. Every howl of wind through the metal railings was a taunt, and every distant rumble of thunder seemed to echo the turmoil boiling in the hospital's corridors. Time was slipping away, and every breath David took was a battle against the creeping darkness. Inside the hospital, tension crackled like electricity. In a private, dimly lit office furnished with polished mahogany meant to convey power and permanence, Senator Robert Davis had summoned Sarah Miller. Davis, a man whose polished exterior hid a ruthlessness honed over decades of political maneuvering, regarded her with eyes as cold as chips of ice. The walls seemed to close in as his voice dropped to a chilling whisper, a sound more menacing than a shout. "Sign these liability waivers and non-disclosure agreements," Davis demanded, sliding a thick stack of papers across the polished desk. The gesture was smooth practiced. "They are standard procedures, Sarah, to protect your father's privacy, to protect the reputation of this institution." Sarah stared at the stack, each page a link in the chain he meant to bind her with. "Standard procedure," she countered, her voice trembling with anger, not fear. "This is hush money. My father is upstairs fighting for his life, and you are down here trying to bury him under paperwork." "Be pragmatic," Davis scoffed. "If this story gets out, it will become a media circus. Your father's care will be compromised. Your career, that promising career your father is so proud of, will be over. I can ensure that." He paused, letting the threat settle. "Sign and his case will vanish. He'll get the best care money can buy quietly. Don't, and it all disappears." Sarah's eyes blazed with defiance. "My father's life is not a bargaining chip." and his legacy will not be defined by your silence. I will not be silenced. Outside that suffocating office, the hospital corridors buzzed with a different kind of energy, one of quiet rebellion. Maria Sanchez, the young nurse's aide who had risked everything to stand by David, felt a chill that had nothing to do with the storm. In a poorly lit records annex in the basement, surrounded by the smell of dust and old paper, she had found something far more sinister than individual negligence. On a flickering computer monitor, a pattern had emerged. 3 other black veterans, Valerius Jackson Thompson, had died under eerily similar circumstances at Westview over the past 2 years. All decorated soldiers, all admitted for supposedly routine procedures, and all dead within 72 hours from sudden, unexplained complications. Their cases had been quietly buried beneath layers of bureaucratic paperwork and official-sounding excuses. It wasn't a coincidence. It was a systemic failure, cloaked in silence. Her hand trembled as she quickly copied the files to an encrypted drive. Upstairs, Dr. Michael Chen, a man whose principles were as meticulous as his medical work, had felt the shift in the hospital's atmosphere. Outrage was its own kind of contagion, and it was spreading. He had gathered a coalition of like-minded hospital staff, nurses, technicians, even orderlies in a disused break room. His voice was low and urgent. We all took an oath, he said, meeting the eyes of each person. That oath doesn't have a political exemption. They are not taking that man out of here like he's a piece of broken furniture, not on our watch. Together, they formed a human shield around the helipad entrance, standing firm against hospital security officers intent on removing David by force. Their faces were grim, their determination unshakable. They were healers, not soldiers, but tonight they had drawn a line. The rooftop helipad was a stark stage for this desperate standoff. The rain slicked the concrete beneath their feet, and the cold bit through their scrubs and uniforms. The group's breath formed clouds in the chill air as they shielded David's gurney from the advancing security team, whose faces were impassive, but whose eyes betrayed their uncertainty. Outside, in the raging storm, Captain Jessica Rodriguez prepared her Black Hawk helicopter for a daring rescue mission. Rain lashed the windshield, and violent gusts of wind tried to shove the powerful machine off its equilibrium. Visibility is near zero. Captain, her co-pilot, yelled over the intercom. He held the line for us in Kandahar. Mike, Jessica, replied, her voice calm and sure. We're holding it for him now. This mission was personal, a chance to save a fellow veteran denied the care he deserved. Back on the rooftop, Senator Davis arrived with a small entourage, his expression a mask of cold fury as he saw the defiant wall of people. The tension was palpable, a silent war waged in glances and clenched jaws. "You are making a grave mistake, Davis," hissed his voice, barely audible over the howl of the wind. "You are obstructing the operations of a private facility. All of you will face the consequences." Colonel Thomas Wilson, a black board member of Westview and a veteran himself, stepped forward. His presence was tall and commanding, his voice steady and authoritative, cutting through the noise of the storm with ease. "No, Senator, you are the one making the mistake. This facility was built on the promise to care for men like him, a promise you are actively breaking. This man's records will not be wiped clean. We will not let you erase his service or his suffering. This ends now." Just then, as if cued by the dramatic escalation, David's heart faltered. He collapsed, a single gasp escaping his lips, the color draining from his face. "We're losing him!" Dr. Chen shouted. The medical team sprang into action, their choreographed chaos becoming a symphony of practiced urgency. CPR began the rhythmic compressions on David's chest, a grim drumbeat against the thunder. The seconds stretched into an eternity as they fought to bring him back from the brink. Sarah knelt beside him, her face streaked with rain and tears whispering pleas. The storm outside seemed to intensify, a flash of lightning tearing across the sky as if nature itself was bearing witness to the struggle unfolding below. Then through the gale came a new sound, a rhythmic roaring beat growing louder. Captain Rodriguez's Black Hawk descended from the black sky, its searchlights cutting through the downpour like divine fingers. The helicopter touched down with a roar, its blades slicing through the tempestuous air, the downdraft so powerful it sent Davis's security guards stumbling back. The side door slid open. The medical team, without a moment's hesitation, lifted David onto a stretcher and rushed him aboard. Inside, monitors beeped steadily, medications were administered, and hands worked tirelessly to stabilize him. As the Black Hawk ascended into the turbulent sky, Sarah looked down. Senator Davis was a small, impotent figure on the rooftop, his fury lost to the roar of the engines and the storm. The turmoil outside mirrored the turmoil within, but inside the helicopter, amid the calm focus of the medical team, hope burned bright. The flight to the military medical facility was tense but swift. David's pulse had stabilized. The team was preparing him for the life-saving surgery he should have received days ago. The rescue was a triumph of courage, determination, and solidarity. But this moment marked not just a victory for David Miller, it was a turning point. On the ground, Maria Sanchez's evidence was on its way to an investigative journalist. Dr. Chen and his team were preparing statements. Colonel Wilson's words had planted the seeds of rebellion within Westview's own board. The battle had moved from hospital corridors to the national stage. The storm over Westview Medical Center may have passed, but the coming storm, the one for justice and accountability, was only just beginning. The aftermath of Colonel David Miller's harrowing ordeal at Westview Medical Center rippled far beyond the hospital's walls. Though David survived the life-saving surgery at the military medical facility, the battle for justice was only beginning. Dr. Michael Chen, Maria Sanchez, and Susan Clark, key figures who had stood up against the hospital's discriminatory practices, were abruptly terminated. Their bravery came at a cost. Sarah Miller, despite her relentless fight, was fired from her law firm under pressure from political forces aligned with Senator Robert Davis. Yet none of this broke their spirit. National media coverage exploded. Investigative journalists uncovered a pattern of neglect and systemic racism at Westview, shining a harsh light on the hospital's failures. Veteran organizations mobilized, rallying public support for reform. Social media campaigns amplified the voices of those who had long been ignored. Senator Davis, once untouchable, found himself under federal investigation. The mounting evidence of corruption, cover-ups, and abuse of power forced his resignation. He faced indictment on charges related to obstruction of justice and abuse of office. His political empire crumbled as the truth emerged. Meanwhile, David Miller's survival became a symbol of resilience and the urgent need for change. His story inspired a nationwide movement demanding accountability and equitable health care for veterans. The Veterans Equal Care Initiative was led by Sarah Miller, Dr. Michael Chen, Maria Sanchez, now a medical student, and Brigadier General Thomas Wilson. Their mission to ensure no veteran would suffer neglect or discrimination again. Miller's standards were established as federal guidelines, mandating rigorous oversight sensitivity training and specialized veteran care programs across medical institutions. Hospitals nationwide adopted these reforms, transforming the landscape of veteran health care. David himself returned to Westview Medical Center 1 year later. The transformation was remarkable. New policies ensured timely and respectful care for all patients. Veteran liaisons greeted arrivals with understanding and compassion. The cold, sterile atmosphere had been replaced by warmth and dignity. Walking through the corridors, David reflected on the long journey from helplessness and neglect to hope and reform. He saw faces of veterans who, like him, had once been invisible. Now they were seen, heard, and cared for. In a quiet moment, David stood before a plaque honoring those who had fought for change. He felt a profound sense of peace. The battle had been hard fought, but the victory was real. His story was a testament to the power of courage, truth, and collective action. It reminded all that systemic injustice could be challenged, that voices raised in solidarity could break through walls of silence. Sarah Maria and Dr. Chen continued their work advocating tirelessly for veterans' rights. Their bond forged in crisis became a beacon of hope for many. The Veterans Equal Care Initiative grew into a nationwide network supporting veterans and holding institutions accountable. Training programs educated healthcare workers on cultural competence and the unique needs of veterans. David's journey had started with a desperate plea for help. It ended with a legacy that would change lives for generations. The story of Colonel David Miller was no longer just about one man's survival, it was about a nation's reckoning and its commitment to justice. This was the true victory. A system transformed, a community united, and a future where every veteran could walk into a hospital and know they would be treated with the dignity they deserved.